Mental health services have become more crucial during the pandemic, and particularly for a population that's been experiencing a sharp rise in anti-Asian hate crimes. And during this time of need, a unique clinic here in Toronto has been offering supports to Chinese Canadians, supports that haven't always been available or accessible.
I wasn't being seen, I wasn't being heard, my experiences weren't being validated because everything that I kind of saw and experienced was through a white lens.
That's what led Madeline Chung to start the Represent Asian Project, a space that celebrates Asian people, is building a community and having crucial conversations, and during a pandemic.
Add in the racism that Asians are experiencing, like I'm scared to go outside for walks. I don't know if I'm going to be attacked. I'm scared about my parents and my elders. Are they going to be attacked simply for being Asian? And that takes a really big toll on you.
But accessing supports isn't always easy. Barriers stand in the way.
Historically, Asian people, or at least like from my experience, Chinese people are really hesitant to seek out mental health care or services because you're kind of told to keep everything inside, to swallow your bitterness or swallow anything that is wrong, and to save face and not bring shame to your family.
A small clinic understands. Toronto Western Hospital is home to the Asian Initiative in Mental Health, offering a wide variety of supports and serving one of the largest minority populations in the country, Chinese Canadians who speak Mandarin or Cantonese.
When people are reaching out and they are not able to communicate in their own native language with someone who understands them culturally, it can lead to misdiagnosis, especially in mental health. And they also can feel not understood, and they are not able to receive the care they need to recover.
The UHN Outpatient Psychiatric Core Clinic is in its 10th year, serving over 4,500 patients annually. Every year, that number grows by 250.
As a population, the Chinese Canadians, they tend to seek services much less than other ethnic groups. That is, they underutilize services. And by the time they present, it's much more severe.
Dr. Kenneth Fung, citing the Ontario Hospital data, says compared to other ethnic groups, Chinese Canadians have more involuntary hospitalizations and higher degrees of severity of mental illness.
It's crucial and critical to be able to provide culturally and linguistically competent care.
AIM is also behind an early intervention psychosis program, a mental health condition where it's difficult to tell the difference between what is real and not. Early detection and treatment is key.
It's one of the major mental illness if it goes untreated and can impact on all aspects of a person's life.
Madeline is hoping to destigmatize getting mental health supports for those who need it.
Just the way that you're going to take care of your body and exercise and eat healthy, you also need to be taking care of your mind.
Through community partnerships, AIM also offers programs and supports to other East Asian groups. Dr. Fung also adds that governments need to add more funding into groups like AIM as the need for mental health supports is on the rise. In front of Toronto Western Hospital, I'm Faiza Amin for City News.